My name is Dr. John Richard. I'm a provider here in the state of Kentucky in Lexington. We were examining patients earlier this week, and we identified a COVID patient who was a healthcare worker who had been previously not able to be screened because of her signs and symptoms did not meet all the CDC protocol. I think she'd been in the emergency room at least twice, I think 3 times. And so she came to see us concerned. We're working in conjunction with a local lab, and we were able to get our return sampling within about 24-48 hours. With that, we sampled her, and it came back a positive. She's on the internet and out on Channel 18 News. I know that she's done a little piece for them. And so she has shared with us her story of how she was trying to protect her grandmother and protect herself. But she had symptoms of fever and myalgias that lasted several days, and she just couldn't overcome it. And so she was concerned, but she didn't qualify. So what we tried to do, because our testing lab said they could test more samples, is we're trying to vet the people here that are the most ill. They have to fill out the CDC form with us and look for illness. If they're asymptomatic, they won't be screened. If they're minimally symptomatic, depending on their risk factors, we'll decide. And of course, if they're symptomatic in a fashion that we find clinically necessary, we will evaluate them and screen them. Most of our studies should be back in tomorrow or the next day, so we should be able to contact all these people and tell them if they're a positive or negative. That's going to be very helpful, I think, to try to continue the social distancing we need to, identify the people that need to be quarantined, and diminish the risk to people's families and such.